Hello and welcome to the Pop Culture Green Room. This is your co-host Kimberly Bryant.
And this is Blair Bryant.
And y'all, today we have with us Dr. Nikolov. Thank you so much for joining us.
Thank you.
Oh, it's such a pleasure to join you this morning.
Thank you. And y'all, we are in for the biggest treat ever. Because we've got renowned Beverly Hills plastic surgeon with us and CEO of CellSound Aesthetics, and we're going to get all into it. So we're going to get started. Oh boy, we're excited for this ride. So happy to have you, and thank you again for your time. All right, let's hear. So how did you get started with this career? Like, was it something that was like a childhood dream of yours, like to become like a doctor, and then eventually like become like a plastic surgeon? Like, how did your career start? Tell us all about it.
Well, the interesting part about this is the fact that I never, ever actually wanted to be a plastic surgeon. I wanted to be an orthopedic surgeon. I wanted to be a heart surgeon. Plastic surgery was not on the radar. And all of a sudden, I thought about it, and there was a certain draw. I already was pursuing a career. I was a general surgeon pursuing a career in cardiovascular surgery, and that's where I thought I was going. But something inside me just said, this is something you should look at. It seems totally vain. It seems like you're not helping people, but you're helping people more than you think, and it really fulfills you emotionally a lot more than you would think. And the more I looked into it, the more I realized that you're helping people, and maybe not in the direct way that you're saving their life every time, but you're helping them a lot more than you realize, and for a very long period of time. And you're making a true difference in someone's life about how they feel, about everything, how they approach everything else, from their friends, their relationships. So for me, it was eye opening, and I've always liked detail. I've always liked symmetry, harmony. So why haven't you looked into this? And I ended up going into plastic surgery. Very much last minute, but one of the best decisions I've made.
Clearly, that's just that's such an awesome story and fascinating, because I would have never thought that you started off in a totally different field in a study. But what really stands out to me, and this is what Blair and I were actually talking about the other day, is that we are so pro plastic surgery, because we're just like people who want to feel good about themselves, let them.
Exactly.
And if that's what gives them confidence, let them. And I mean, it's like it makes a world of difference. And like you said, it helps better relationships, the confidence, the friendships, and it's just. And I've seen it because when I lived in San Diego, I've had a lot of girlfriends of mine and even some guy friends, and I've had that going under the knife. And I mean, it's just the world of difference and it brings, and I plan on doing it. I've got a whole notebook written out like what I want done eventually, but it's like you said, it just brings so much to the aesthetic. And so,
absolutely. And I feel like it kind of boosts a sense of morale too.
If done the right way for the right reasons, and of course, too much of a good thing is never a good thing. But if it's done for the right reasons, it's fantastic, and you see a change in personality. I remember seeing a young kid, 17, that I operated on him, and he hadn't had a job, was very shy. Absolutely, his mother was very worried about him. If anything, actually, I asked his doctor to see if family doctor, if there was any depression, psychiatric issue, because I was so concerned he was out of the norm.
Right.
and I ended up doing his nose, reduced it quite a bit,
Mhm.
and his mother came in month and a half later, and she's crying, and I hadn't seen him yet. And it's like, oh
Uh-huh.
my God, did something happen to the nose? Maybe he hates it. What's going on?
Mhm.
And she goes, you don't understand. This kid hasn't been out of the house for years. Within month and a
Oh,
half, he has a new job. He went and got his driver's license. He had never gotten it. In LA, that's not that common. You always
Yeah,
want to
no, it
drive.
isn't. Yeah.
right.
And he has a girlfriend.
Look at
And
that.
Wow.
she was like, I can't even express to you what you've done for him.
Aw.
And that has stuck with me because here is somebody at 17 that it was
Mhm.
such a huge turnaround in such a
Right.
short period of time.
Right.
He must have done something right.
Oh, absolutely. So
Definitely.
especially it's such like crucial years of your life, and for him to find to get what he needs to really kind of help with his self esteem and help him in every aspect of his life, as you can see.
Yeah, it's such a beautiful story because those are the things and
Right.
the impacts that plastic surgeons have on people that a lot of times that y'all don't get the credit for because a lot of times people don't hear those stories, and that's a
Right.
beautiful one.
Well, a lot of times people always think of the people that had too much, gone
Hmm.
That's true.
overboard.
That's true.
And of course, there is such thing as discipline. As a surgeon, you have
Mhm.
to do the right thing for the patient. You have
Right.
to sort of let them know what are realistic expectations, respect their wishes. But my rule is if it's something I wouldn't want to do to myself, I probably wouldn't want to do it to someone else. If
Got it.
I
No,
would
that totally
not be
makes sense.
happy with it, it's hard for me to do that surgery for you because, first, I don't envision it,
Hmm.
I don't feel it, and second, it doesn't feel right.
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 Yeah.
Oh yeah, for sure. So like going talk about your journey. Like, so you've built an international reputation in Beverly Hills and in Madrid. So like, what inspired your path to become plastic surgery and to do aesthetics, and like, and how what eventually led you to self sound aesthetics?
Cell sound aesthetics is a continuation of many things I've done throughout my career. And again, one of the other rules I have, and as you can tell, I have a lot of rules, is I try to do things in the easiest, simplest way possible. And when I say easiest, not necessarily for me, but the easiest for the patient, least
Right.
risky, safest, least recovery, and also still be able to get them the right result. So I started initially with some other technology with in-mode aesthetics, was very much involved in the very beginning from body tight, face tight, Morpheus 8, helped develop a lot of the protocols for treatment. And the draw was yes, I can accomplish things with less trauma, less recovery, and patients, of course, are happy when you do that. Well,
Oh,
Cell
absolutely.
Sound came across, and this sounded too good to be true. And as a general rule, if it's too good to be true, it usually is. Well,
Yeah.
this was
Right.
the exception because this is a technology, and somebody presented it to me, and I hate to admit it, but my first response was, yeah, 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 okay, thanks. Basically, get out of here, don't waste my time. So it's somebody I knew. He said, no, 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 you should really, really look into this. It really does these things. So
Okay.
I ended up spending some extra time investigating it. And this is a very new revolutionary technology based on something we've used for a long time, which is ultrasound.
Hmm.
What it does is we're able to improve blood flow in the tissue. We're able to improve lymphatic drainage.
Okay.
As a result of improved blood flow, we're improving collagen formation, we're improving the cell division to a more youthful rate.
Oh wow.
And best of all, we all like being shapelier and
Mm-hmm.
thinner. So whenever we want to, we can decrease the amount of fatty layer, whether it's the stomach, the flanks, under the chin. We can sculpt with it and also give you a more chiseled look, a more refined look. And all of this is with no downtime, no
Oh
pain
wow.
during the procedure. So now you know why I thought, okay, this is too good to be true, and
Yeah,
it's
no, for
Right.
sure.
another one of
Yes.
these devices.
Mm-hmm. So it's like you're getting almost like I saw like a commercial before for some other advertisement. It's almost like you're getting like a tummy tuck without having the downtime and all the recovery, right?
Well, a tummy tuck involves a few other things, and I would never want to compare it to such.
Got it. Okay.
But it would reduce the amount of fat
Okay.
measurably,
Mm-hmm.
and it will make you more sculpted. It will not tighten the muscle. It
Okay.
does improve the skin tone, but once again, a tummy tuck, you cut out
Right.
Right. Yeah.
10 inches or more. With this, I can tighten it 10 inches. That's a lot.
Mm-hmm.
Right. Right.
But we can still improve how you look. And even works on people that are thin. You still see a significant change. So you don't have to be a little more generous in the waistline to benefit from it.
Right.
Okay. Got it.
That's good to know.
Yeah, that's very, very good to know for sure. So is this a procedure that's definitely been increasing like over the years that you've seen with clients? Is it like coming up in popularity or is it on the rise?
We all have busy lives and we all are looking for the next thing that will just
Mhm.
go in, make us look better, and get out the door.
Oh, for sure.
So if you
Yeah.
have something that doesn't hurt, you can go in for an hour, walk out, go straight to dinner or to work or whatever you have going on afterwards. Don't have to suffer through it, and you see a difference. You can see the appeal in it. So, yes, a lot of people that have been exposed to it, they're, I hate to use addicted because it has a negative
Right.
connotation, but they're getting addicted to it because they're improving the way they look. And
Hmm.
also, just as importantly, they're improving the health of their tissue.
For sure.
The
Right.
tissue is healthier, better perfused. It's and there's no inflammation as a result of it. And we all know the negative things of inflammation.
Hmm.
Right.
And one exciting thing I forgot to mention for guys, this penetrates 10 centimeters deep. So a lot of guys have a lot of fat over
Uh-huh.
the muscle, but a lot of it is intra-abdominal. And with this penetrating 10 centimeters, you have to be getting some of that too. You're
Got
going to
it.
look thinner. And
Yeah.
liposuction won't get that intra-abdominal fat.
Right.
Nothing
Yeah.
will.
That's true. Yeah. No, that
Like
sounds
a
like
little
a
more
great.
chisel
Yeah.
torso.
Right. That sounds like a perfect procedure. But not only that, but think about if someone's got like maybe like they have to go, for example, like the Oscar Awards, and they need to get like into a dress that they're not like used to maybe fitting, and they've got like a few days just to. It sounds like that would be like a perfect procedure for that. And not only that, but they're coming out feeling better, and then not only it's a healthy procedure because they're improving
Uh,
their cells.
it makes a big difference. We just had someone that did the cover of Harper's Bazaar, and guess what she used to prep for the shoot?
Oh, she's the CellSound aesthetics.
So it really is something, even if you're thin, it gives you that extra edge where you look even better. So it's not just for
Yeah.
people
Hmm.
that have a lot of extra fat. Models, I have several patients that before a shoot, they'll come and do 2 sessions just to tune things up.
Yeah, and the maintenance is always. I mean, I'm always a maintenance
Oh,
type of
right.
person,
Exactly.
and I think that's so important, especially for I mean, especially at our ages, because we're 44 years old now, so we're getting older. So it's like you're always just trying to find things to help you like decrease like your age, your aging cells and all that.
Right.
So just to know that it does that, so it's even more exciting. So, that's the most exciting part to me. Of course, yeah, to get a little more right and tight. I like that too, but just that added bonus to it. Oh my goodness,
Well,
it's
if you think about all devices on the market right now, anything that gives you any tightening, any reshaping, it pretty much achieves it by causing some form of inflammation, whether
Mhm.
it's heat, whether it's with freezing, whatever the case may be. It generally would kill fat cells if it's for fat reduction, and it will heat up the collagen, cause inflammation that it tightens. Inflammation, we keep hearing it, it's not good for you. And I'm not saying short term getting inflammation, that's going to be the end of the world. But
Mhm.
again, inflammation is not in general good for you. And if you can
Right.
get something done effectively and even
Uh-huh.
better than most devices there and achieve it without any inflammation, downtime, or any pain or damage, it's a no brainer, at least for me.
Right. Definitely.
So if
That
I'm
makes sense.
excited about it, you can understand why. But
Yeah, no, I agree with
I
that. I'm
was
all
the guy
excited
saying,
about
hey, get out of my office.
it.
Uh,
Oh, for sure. We're gonna definitely send plenty of people to your office. I'm like, because we've got gobs of people and girlfriends who are just like lined up and waiting. They're waiting for this episode.
True.
Oh,
Yeah.
and they're coming there next to like, I'm serious. I'm serious. Can really contact
Right.
information.
So like being that you're based out like in the Beverly Hills area, like are there any like specific Beverly Hills look per se that clients are learning about and like, want to achieve like currently, like that's currently on trend?
Well, the major trend that I've seen in Beverly Hills, and not that Beverly Hills is the end all, but it's sort of shows where things are going frequently
Mhm.
because a lot of influencers, movie industry people, that's where they get their work done. And as a
Right.
result, they influence everybody else. But the major trends that I've seen, people are doing things earlier and they're
Mhm.
doing their patients asking for facelifts at 40.
Hmm.
Sometimes it's too early and you have to use a lot of judgment. But they're not waiting till they're 60 to do any work and make themselves look better. And that's why it's very important if we're going to start addressing issues earlier to have things that cause less damage and less inflammation. Fewer marks of someone like me having been there.
Hmm.
So
Right.
improving the techniques makes a big difference. But facelifts have been done earlier. The other trend is I have girls in their 20s coming in for Botox as preventative. Don't
Hmm.
get me started on that because I think that's way too early and
That's
there's
I
no
agree.
yeah,
such thing as preventative.
that's
Just
always
do it
like
when you need it.
yeah.
But
Exactly.
that's a totally different discussion. It's
Right.
just indicative of how much more aware we are of our appearance, and maybe it has to do with social media. People are looking at themselves, and now they want to look better all the time, and not just wait till they're falling apart.
That makes
Definitely,
sense.
yeah. And actually, that you actually answered part of my question because one of my girlfriends, Diana, had asked me. She was wondering, like, what do you recommend, like, for minimum age for a facelift? And I guess she's referring to like the deep clean facelift that everybody's getting now. Like you see, like Kris Jenner's had, it looks phenomenal. Like, what would you recommend at a minimum age for that?
I never go by age. For
Okay.
me, the age is irrelevant. What are
Okay.
we trying to improve? What is it that bothers you? Is there a safe, reliable way to achieve what you want to do? So, usually I wouldn't do a facelift at 40. I think it's
Mhm.
way too early.
Right.
However, have I seen patients and have I done it? Absolutely.
Mhm.
Yes, it's very much the less common occurrence because most women in around 40 can do a lot of things to help with their concerns and not do a facelift. So it's not about the age. What is it that you have, and can you improve it? And what's the easiest way to do it? Easiest for you as the patient.
That makes
So
a lot of sense.
that's the important part. She may be 40, she may be 50, she may be 60, and also look at alternatives. A facelift is not the end all. I love doing facelifts,
Right.
but at the same time, it doesn't mean that when you're unhappy with your appearance and you're getting a little bit of extra under your chin, you get a little bit of jowling, that's the first thing you have to go to. The other question that you asked is deep plane facelift.
Mhm.
I have very strong feelings about that.
Okay.
I think it's a good procedure for the right patient.
Got
But
it.
it's not the situation, oh, it's so great. You know, the old expression, if you have a hammer, everything is a nail.
Mhm.
It's not the right procedure for everyone.
Got it. That makes
Okay.
And
sense.
I mean, I personally probably perform 5 different types of facelifts, and it all
Okay.
depends what you need, why you need it, and trying to get you the result that you truly want. That's what makes the biggest difference. So, is it a
Mhm.
good procedure for the right person? Absolutely, but not for everyone. And because it's gotten so much press lately, and this is not something new, Dr.
Right.
Kamer, who is no longer in practice, was doing deep plane facelifts 30, 40 years ago.
Okay, so
Uh,
this is something that's been done for a while.
exactly. So it's not a new
Okay.
procedure, but all of a sudden it's become a fad. It's almost as if that's the only type of facelift that exists. And that's not the
Mhm.
case. There are
Right.
plenty of good facelifts. And ultimately, if done the right way and approaching the right issues, it's been shown that you can probably do 2, 3 different types of facelifts and pretty much get to the same result and also get the same longevity out of it.
Right.
So I don't like people being enamored with a name because they've heard of it.
Right. Yeah,
That makes
that makes
sense.
plenty of sense because now that you say it, it's like someone can go in there and get all this work done that's unnecessary when they just need maybe just need
Just
like a
minimum,
yeah like little
minimum
touch or
work. Yes.
something, yeah. And I didn't even think about that until you brought it up and stuff because isn't it like more of like a very serious procedure, like I think they said it involves nerves or something.
Well, it's not. It just goes in a deeper plane, and the way it's
Okay.
done, it's a little bit of a higher risk of nerve damage. So,
Okay.
yes, you may have a droopy lip, that it doesn't move as much and doesn't depress on one side and more so on the opposite. So there may be nerve damage, but again, that's not the reason not to do it. And I'm not trying
Yeah.
to say it's a
Right.
bad procedure. It's just choose wisely and choose what's right for you, not what was in social media.
That makes sense.
And
Yeah,
that
that does
that's
make
kind
a
of
lot
the
of sense.
best way I can say it. And also to put people's mind at rest. Excuse me.
Sure.
One, this was done many years ago at a meeting, and I'm surprised they did it. But one side of the face was done by one surgeon, so it was even different surgeons with
Oh
one type
wow.
of a facelift, and the other one was done with another type of facelift. But both of them very good surgeons.
Uh-huh.
And you would think there would be a great deal of difference, but they were done well, addressing the right issues. And looking 10 years later, looking at photographs, The longevity of both sides was the same, and the
Interesting.
improvement seen was the same.
Oh
That's a really
wow,
fascinating study.
yeah, that is a very fascinating study.
So ultimately, I think what matters is having a surgeon that knows what he's doing and knowing what your concerns are so he can appropriately address them.
Right, that makes a lot of
Got
sense.
it.
So shifting focus a little bit, so you have clients like internationally as well. Have you seen any differences in like the beauty standards? I mean, I know they do exist, like that different like difference between like LA, Beverly Hills, and like out in Europe.
Of course, I mean, we can start with many things. People in Europe have work done. They don't like talking about it.
Oh,
They don't like letting their friends know.
oh, that's interesting.
Unfortunately, some of the work, and I'm not saying anything negative about European surgeons, but some of the work on more prominent people, unfortunately, has stood out quite a bit in a negative way.
Oh
That's
wow.
been overdone. But in general, most people don't want everyone to know they've had procedure done. You look at LA, it's the total opposite.
Right,
People will
yeah.
share with friends and they're not bragging, but they're not embarrassed. Now, you
Hmm.
go to the Far East, I've had experiences where people didn't need a facelift, but they will come in and say, "You don't have to do much. Just make a cut there and close it. I want the scar." So,
Oh
for some
wow.
people, it was a
Mhm.
status symbol just having the scar of a facelift that they had one done. So they
Oh,
were showing off about it. So it's
Right.
a
yeah.
very wide range. And again, this is very much generalizing, but it tells you how we all are victims of our society. We all want to show off because everybody else does. We want to
Right.
hide it because we feel judged. Or the best thing about LA is I think most people feel accepted and they don't mind
Mhm.
sharing with friends because they're not embarrassed and they're fine with what they've done. They feel good about it. Now,
Most
other
definitely.
trends I can mention, you can look at breast size, which is interesting. I came across something on Instagram, average breast size in each country. I was quite surprised.
That's
A
interesting.
map.
Yeah.
Is
Uh,
that like very, very different, like in each country? Like,
it has to do with what is considered attractive. You look
oh,
at
got it. Makes
Brazil,
sense.
big breasts are not considered attractive. You look in
Mhm.
Europe, yes, size has grown. Women are getting more and more breast implants, but still, they're not huge. They're more modest size.
Okay.
And fortunately, at least that's my bias, but fortunately, even in the US, if you look at breast size, we've gone away from, okay, I want to be huge,
Yeah,
and
right. That's
gone
very
to,
interesting.
I want to be proportionate. I want to be
Mhm.
comfortable. I want to look good, but I want to feel good as well.
I've noticed that, and I've noticed that more people are they're focusing less on the breast and more on the, or they still get the breast, like you said, more proportion, but they're more focused on like their butt and their hips. Is that still a thing, or is that dying out? Or
Well, again, we're going back to one of the things I started with. Too much of a good thing is no longer a good thing.
Mhm.
Right.
Right? Yeah.
And breasts that are too big, no, they're not flattering. But also,
Mhm.
same thing comes with gluteal augmentation or the Brazilian butt lift, where fat is injected.
Right.
And it got to a point where I would see women. I had a patient of mine, and I refused to do it. She went someplace else, and she came back to the office, and she couldn't even walk. I mean, honestly,
Wow.
Oh
it's
wow.
not an
That's crazy.
exaggeration. She walked like a
Yeah.
duck.
Oh, I
Oh.
believe it.
Absolutely gorgeous girl. It broke
Mhm.
my heart.
Oh goodness.
And now people are looking, including her, they're looking at taking some of that fat out because they realize they went overboard.
Right.
Makes sense.
Oh
And that's
goodness.
where I think the responsibility, and I feel the responsibility as a surgeon to also guide. I don't want to dictate your choices, but
Uh-huh.
also I want to guide your choices.
Of
I
course.
want to make sure you're happy when you're 20, but I want to make sure you're happy when you're 30, 40, 50, and not just for the following 2 years, but for the following 50 years. And to think about the choices you're making long term, not uh, a flared jeans fashionable now, they won't be for long.
Mm-hmm.
Right,
Uh,
exactly.
it's you have to look at it as what's good for you and what's going to keep you looking good for the rest of your life, and that's an appropriate way to approach it. And as a surgeon, I feel that's one of my responsibilities to bring it up and to help you make good choices.
Right. I definitely like that a lot because you don't find that
No.
with many people because like you're being real and honest and like I said, you want them to go in there and just and have the work done and for that longevity. And I really like that so much about you because you're not like oh I'm gonna get you in and out and quick and out the door and then go. It's like no, it's like there's a lot more to that. And that's what I really like so much. And then which leads me to here. So because with like social media changes, like I mean, it's obviously it's a game changer for what
Right.
it's done now with plastic surgery. So we've got fillers, like filters that use for camera filters, AI enhanced images, Facetune. Like, how does that affect people's expectations when they go into your office? Do you see people that go in there with like AI images or filtered pictures? Be like, I want to look like that. Does that
Oh,
happen often?
all the time.
Oh, wow. I figured.
Especially younger patients, but not even
Mhm.
just younger patients.
Oh wow.
They will bring an Instagram photo.
Hmm.
I want to look like that. And the discussion always has to be, do you like the proportions or do
Uh-huh.
you want to really look that Photoshop? Because that's impossible. And frequently they will bring an AI generated image, which
Hmm.
is, maybe I can get somebody to do a photo of them and brush them up like that, but you can't do that in real life. It doesn't even look human.
Exactly.
Right. That's how I thought it was crazy when I was like, do people really bring? I was curious. I'm glad I asked that question. I was like, if people really bring stuff like that in, and they're like, I want to look like this, but
I mean,
I
it
don't.
really is important when you look at someone and for them also to appreciate that everybody has their own beauty. Everybody has individual beauty, which you cannot create. You can only take away if you're not careful. So, as a surgeon,
Right.
you have to enhance what they have, not try to make them
Yes.
look like someone else, because
Right.
then there's nothing left. They're just generic. Nothing comes across. You don't feel the personality of the person, of that particular individual. You don't feel it coming across. It's just blank. And they can have perfect proportions, and it doesn't mean you'll find them attractive. My general rule, again, one more rule, I want you to look like someone, if I saw you at a party, I want to go talk to you.
Uh-huh.
Right.
I want to feel like you look great, but you're approachable, friendly. It's someone I would enjoy having a conversation, discussing things, and it makes you feel good looking at that person. It's not about perfection, it's the perfection in expression and individuality that is more important.
Got it. That makes sense. Oh, definitely. And it's like put the focus back to you. I was wondering, like, so how do you like balance, personal, balance your demanding career, your like wellness, health, and like downtime, personal time? How do you balance all of that?
That is a good question.
Poorly.
Really? I was like, inquiring minds want to know.
I'm so good at it. But if I were to be honest, very poorly.
Oh,
Uh, just because there are too many things and it's a constant balance, whatever you do, you always feel like you're neglecting something. Whether it's your work, oh, I could have done more there, I could have done this, I could have done that. Whether it's personal life, you didn't spend enough time at home, you didn't spend enough time with your children, you didn't take care of something around the house, whether it's with friends that you want to make sure that you don't neglect your true friends, because
Right.
ignoring them, well, then they're not friends, or they shouldn't be your friends. There's got to be uh, an interaction and kind of a mutual benefit and enjoyment of that relationship. So
right.
every time when you have a busy life, at least for me, I always feel like I'm failing on some front, and usually I feel like I'm failing on all fronts.
Oh, got it. Oh
Oh,
boy.
oh. We know at the end of the day we're all human and we try to do, hope we do the best we can. I hope we get you some downtime soon.
Well, on the other hand, there's only so much time you have. You might as well live it up and you might as well do the most you can with it.
Yeah, I
So,
agree.
just if you have too much free time on your hands, I mean, it's fantastic, but I guess I've never had that issue, so I wouldn't know what to do with it.
Right.
Oh
That's
gosh. Oh,
understandable.
for sure. I get that for sure. Yeah, so one of my questions that I have for you to kind of get back a little bit to the cell sound. So what do you see as for the future of like for of non-invasive aesthetics? Like is it like person do you see it as like personalized beauty like via technology like from like cell sound where it is like less invasive where you're in and out? Do you see more of that like growing in the future?
I absolutely do. And I don't think surgery itself would ever be replaced.
Okay.
However, a lot of treatments can be performed in a less invasive way. A lot of things can be performed earlier, since we're all getting a little more aware of our appearance and
Mm-hmm.
trying to do something about it at a younger age. But you can do it in a way that it doesn't cause a lot of harm. They're not any permanent alterations, they're just improvements. And doing it in a way that it doesn't do damage, it just improves the health of the tissue overall, not just the appearance. I think that overall rejuvenative effect is very important. And I think that's an important trend, rejuvenation. It's not
That's
about just looking good, but also feeling good and being healthier. And with cell sound and other technologies, and not to get into the weeds in rejuvenative medicine, but there are a lot of new things coming to light that are making you stay a little bit younger. As a result, you look a little bit younger, you're healthier. And that's an important trend. Like anything, you can go overboard, but some basics need to be followed by all of us, not just for being vain, not for vanity's sake, but also just to be healthier, to have a better quality life and live longer. And that's where some of the newer techniques, newer devices, newer approaches, I think will grow and make the biggest difference. It's not just look better, but also be healthier.
definitely.
Right. Oh, that makes perfect sense.
Yeah, so like what advice do you have for someone who's considering like any kind of treatment, but they might be a little nervous about it, have a little apprehension to start the aesthetic journey?
I think finding someone whom you can speak to and discuss the procedure, discuss what your concerns are. And my advice would be don't go in and say, "Oh, I want tummy tuck, or I want breast augmentation, or I want a facelift. But go in and say, this bothers me. I don't like the way this is hanging here. I don't like the way
Right.
this looks. What can I do about it? Have a conversation just so that you have a better comprehension of what is there, what can be done, what are your choices. You should always have choices. Now, one
Right.
could be better than the other, but you should always have choices. Give yourself time to process and understand what journey you're taking, what it means to you long term, what you can expect as a result the next day, as well as 10 years, 20 years from now. And having a relationship with your doctor that it's a back and forth, he can educate you so you can help in the decision. It's all about you
Mhm.
and what's going to make you happy. And there's no
Right.
doctor that can tell you what's going to make you happy. They can give you choices, they can educate you, but ultimately, you have to feel it. You have to feel this is right for me. I know I want to do this for myself and I'm going to feel good about it. But it takes
Right.
some time, and if you don't get educated, you're trusting somebody to make that decision, and they don't know you as well as you know yourself. So let your
Right.
doctor guide you, but be part of the process.
Right. Well, that makes a lot of
Definitely.
sense.
Oh, I like that a lot. That is great. So, random, do you have like any like maybe three beauty tips or tips that you would give someone that's like whether they're red carpet ready or just ready to leave out the door, just about wants like a fresh look? Do you have like any advice, like just anything daily they can do to like preserve themselves?
See, I have lots of tips. So let me narrow it down to three.
Sounds good.
Just as far as basic tips, it's going to sound weird, but wash your face. Don't leave
Ooh.
makeup on at night. Wash your face, keep it clean. Don't use many harsh chemicals on your face. Be kind to yourself and as to your skin. Number two, I think I shouldn't say avoid the sun. I like the
Mhm.
sun and
Oh,
it's
me.
good for you, but don't go fry in the sun. Find a shade.
Right.
Make sure that you're not have direct exposure and you don't burn your skin. That is damage that you're going to see initially, but years later, you're really going to wish you hadn't done that. I've seen patients that look 20, 30 years older than they are, that are fit, everything
Mhm.
else is great, but the skin, well, it looks like shoe leather.
Oh,
And
wow,
not
from
to be
sun
overly
exposure.
graphic, but
Yeah.
just from being in the sun. So be
Oh,
careful. It doesn't mean you have to carry an umbrella walking on the street everywhere you go. Absolutely,
Okay.
please don't. But at the same time, just be conscious of exposure and don't try to go lay out in the sun and see if you can catch a few extra rays. That doesn't help you. So those are some general things to think about. If you're trying to get carpet ready, doing it early, usually some things like doing a little Botox can go a long
okay.
way at softening the look. And there are different forms of Botox. So even if you do it a few days before, it can still work. That's number one. That's a quick tip. If you have puffy eyelids, there's several preparations. One of them is going to sound weird, and most makeup artists know that. But using some preparation H, careful
I
not to
heard
get
that.
it in your eye,
Mhm.
under the
Oh,
eyelids helps some of the puffiness. There's some makeup that can tighten that as well. Some creams that help with that. So that generally helps a great deal. And overall, when you go on the red carpet, the best advice I can give anyone is just don't worry about it.
Mhm.
You're there, enjoy the moment, because it's not whether you had that extra freckle or not and somebody's going to see it. It's all about how you feel, the energy that radiates from you. I think that matters a lot more than anything else. So enjoy the moment, be there, be present, and soak it in, and show everybody who you really are, and don't sweat the small stuff.
Absolutely. That is
No,
awesome.
actually, that's great
Oh,
advice.
that is so great. So can you tell our audience where they can find you and how like their information? We're also going to leave it in the description with your information.
Well, for me, I have a website. It's Dr. Nikolov, DrNikolov.com. And also on Instagram at Dr. Nikolov. So they can find me there. And for Cell Sound Aesthetics, the website is cellsoundaesthetics.com. So those are two easy places to get further information. But even just Googling cell sound, it will come up. It will come up
Awesome.
easily, and you should be able to get plenty more information. I'm sure I haven't even done it justice explaining, but it's I've drunk the Kool-Aid, as you can tell, and I'm very excited about it.
And we love your excitement.
Oh, we do.
Oh
Yes.
my gosh, but we still definitely we cannot thank you enough for your time
Oh,
today.
yes. Thank you so much, Dr. Nikolov.
Oh, I know. We know you're super busy, and y'all, we're gonna leave all the information for you and links, so, especially for my girlfriends because they've been asking and begging. So.
Yes.
Oh, but yes, but thank you again, and y'all don't forget to like, follow, subscribe, and share. This is Kimberly Bryant,
This is Blair Bryant.
and we are the Pop Culture Green Room. Have a great day. Bye bye.
Thank you.